Hi guys. We are going to talk about the first half of the digestive system today. It will go through the stomach, and then the second video will be from the stomach to the rest of the chapter. Um, First, these are basically the functions of the digestive system. Ingestion means taking food in. Mechanical processing, we'll talk about, involves chewing and your stomach actually churning food. Then digestion itself usually has to do with the chemical portion of your digestive process. What gets secreted into food to help it digest? What do we absorb? And then obviously, what do we get rid of with excretion? These are all the different parts of the digestive tract. You start with your mouth or your oral cavity and you go through all of these, and then you obviously end up with the anus. And this is the order that we talk about the digestive system. This page is really, really helpful because it shows you all the parts of the digestive system, what's included in that, and what they do. So this, you might want to either take a screenshot of it or kind of bookmark this page. It's really, really helpful as kind of a screenshot of everything that's going on in your digestive system. We're not going to worry about the histology part. Two terms that are going to happen as your food are digested are peristalsis and segmentation. So when you swallow, there's smooth muscle in your esophagus and really in all the other parts of your digestive system as well. And that smooth muscle contracts to move the food forward. So yes, when you swallow, gravity is obviously helping food make its way to its stomach, but if you've ever tried to swallow upside down, you may have noticed that you can do that as well. It's because the peristalsis moves food down along the track. Now, segmentation means that food is also churned, so it swirls around and around. So the combination of pushing food down and swirling it around helps expose everything to the chemicals along the way and any parts of your digestive tract where absorption take place. Oops. So this is peristalsis. The contractions happen behind the food, and then segmentation is when it is twirling or swirling around, and that's what these pictures are. Okay, we're going to start in the mouth, aka your oral cavity. Lots of functions in your oral cavity. Sensory analysis of potential food. In other words, you're going to taste. Is this something I want to eat or not eat? Mechanical processing means physically breaking up food. Yes, you use your teeth, but you may not have realized that when you chew, your tongue is also helping to do that along with your hard and soft palate. Lubricates food because mucus in the saliva is secreted into your mouth. If you've ever done that silly trick where you want to see how many saltine crackers you can fit in your mouth, you may notice that after a while you get very, very dry. Well, your food really goes down a lot easier when it is moist, for lack of a better word, and it gets moist because of the mucus and the water in your saliva. And then also in that saliva, there is an enzyme, and that enzyme is called salivary amylase, and this is where carbohydrate digestion starts. So that's what all happens in your mouth. Your mouth is also sometimes referred to as your buccal cavity. That root word may sound a little bit familiar if you think back to muscles and you remember the buccinator. That was the blowing muscle. That is because the word buccal refers to the mouth area. So within your mouth, obviously, you've got the tongue. Again, the tongue is for mechanical processing. When you chew, your tongue is actually pushing food up against your teeth and up against the roof of your mouth, helping to break it down. It also actually helps push food back down your esophagus when you swallow. And I've posted some videos in the folder so that you can watch the swallowing process and see what all happens during that. Obviously, taste and texture. Some people have real texture issues. I know there are a lot of people that you don't like pudding or you don't like Jell-O, things along those lines. I know people don't like bananas because of the texture. That all has to do with your tongue. And then obviously speech. If you think about the way you talk, just say a couple of words and pay attention to what your tongue is doing. People that have speech impediments, where they will go to a speech therapist and they literally will practice where their tongue goes in order to say their words properly. I used to have a lisp where I couldn't say my S's. And so I had to go and practice literally putting my tongue against the back of my teeth and going like that to try to say my S's. Here's your tongue, obviously. There's your uvula. That's a little hangy ball right in the back. That is actually for a gag reflex, and it also helps food not go up into your nasal cavity. This is called your frenulum. That is the little stringy thing underneath your tongue. If you want to lift up your tongue right now and feel it, little stringy thing. That is to anchor your tongue to the floor of your mouth so that your tongue doesn't fold back and choke you. The other interesting thing about your frenulum, if you've ever heard the term being tongue-tied, we use that when somebody trips over their words a lot, but being tongue-tied is an actual physical abnormality. Some people are born where their frenulum is too short or too tight, and their tongue cannot move to make sounds properly, and so they actually have to have it snipped a little bit so that their tongue can move a little better. And then if you actually pull your bottom lip down, there's another little stringy thing. It's called the labium. It's what holds your tongue into your bottom jaw. Looking at your mouth sideways, remember your tongue is a muscle, and it is attached way back down in here. There's a cheek on the inside there. You can just take a look at those. Now, you have 3 pair of salivary glands: parotid glands, sublingual, and submandibular. And all 3 of these produce saliva. Purpose of saliva is, we talked about moistening your food. It actually cleanses your mouth. So people that have dry mouth, from a lot of times it's from medications they take, causes bad breath. And so saliva actually helps to clean your mouth and will suppress bacterial growth. Now, those 3 pair of salivary glands: parotid, sublingual, and submandibular. The parotid are right here, right in front of your ear. So there's a duct that leads from your parotid glands into your mouth. See this duct right here? I want you to take your tongue and I want you to put it on the inside of your cheek. See if you can feel that duct. Like, I can always feel where my duct is, and it always seems to be, it seems like it's where you bite your cheek sometimes when you're chewing. But that's the duct that takes saliva from these parotid glands right into your mouth. Now, these parotid glands can become infected, and people that have an infection of the parotid glands, that's mumps. Well, you guys are never going to have mumps, because when you were little, at least most of you, if you were vaccinated, you had a vaccination for measles, mumps, and rubella. So you won't get that nowadays. It's kind of an old school infection that we don't get anymore. The sublingual are the ones right under your tongue. And if you ever have heard of what gleeking is, right here are the openings to those sublingual. And there are people that can literally shoot spit out of those two, kind of like a snake almost. That's what gleeking is, but that's saliva. And then the submandibular, those are the ones under your mandible. When I eat something sour, for me, those are the ones that feel like they are just going crazy and secreting a whole bunch of saliva. Excuse me. When also in the mouth, we've got teeth. One of the most interesting words to say in anatomy and physiology is the word mastication. Make sure you pronounce that properly. But that's chewing. Mastication is just chewing of food. And your teeth, basic shape is formed from dentin. Enamel is the white stuff that covers your tooth, and then cementum is what covers the root. You've got 20 baby teeth and 32 adult teeth, and those 32 adult teeth, yes, do include that extra set of molars or your wisdom teeth. Part of the tooth we see is the crown. The neck is right here at the gum line, and then the root is what goes down inside of there. You'll notice that there's an area inside the tooth we would call the root canal. That's where blood vessels and nerves are. And if you've ever had to have a procedure called a root canal, that's usually if something has happened to your tooth and you've got an infection or your tooth has died, they'll drill all this out. And so basically you have a dead tooth, but they will keep it there so the other teeth around it don't move. The procedure to take all of this out is called a root canal. Here are what all your different teeth are. This is a baby mouth. You can see that it says these lateral incisors show up about 9 months. Your front teeth show up about 7.5 months. It's actually not unusual for babies to get teeth sooner than that. And believe it or not, babies can actually be born with teeth. My daughter got her first teeth when she was 3 months old. Now, here are the adult teeth. Incisors, cuspids, premolars and molars. You may have heard the terms bicuspids and tricuspids. Bicuspid is premolar, tricuspid is a molar, and it just has to do with how many grinding surfaces there are. And yes, your third molars, these are your wisdom teeth. Most of us don't have enough room for these, so those have to come out. From our mouth, we move down to our pharynx, and we talked about the pharynx a little bit in the respiratory system because this is a common passageway for both food and air. Remember, and it is what we call our throat. So we've really already talked about that. So from the pharynx, we move down to the esophagus, and the esophagus is your food tube. It is only about 10 inches long, and there is a sphincter, which is a circular band of muscles that closes your esophagus off right at the top and then also at the bottom before it goes into your stomach. And so those sphincters are there to keep food in your esophagus and preferably not coming up and projectile vomiting. The term for swallowing is technically deglutition, another fun little word. There are 3 steps to deglutition. There's an oral phase, a pharyngeal phase, and then an esophageal phase. In other words, part of it takes place in your mouth, part in your pharynx, part in your esophagus. So in your mouth, when you chew up your food, food is no longer called food. At that point, when it's all soft and mushy, it is called a bolus. So it's what we call food when you chew it up in your mouth. It goes from there into your pharynx. From the pharynx, it then goes down into your esophagus, and your esophagus, because of peristalsis, talked about that, pushes food back down to your stomach. So that is the act of swallowing or deglutition. And these are just some pictures that show that. I've also put some videos in the folder that are pretty cool to watch about swallowing. Now, I don't know if you've ever heard of a hiatal hernia before, but so your esophagus literally has to go through your diaphragm to get to your stomach. There's a hole in your diaphragm. There's supposed to be, but it's just not supposed to be very big. Well, usually the esophagus goes right about here, and it goes through, and then the food goes down in your stomach. Well, for some people, for various reasons, your esophagus literally backs up, and sometimes part of your stomach backs up through your diaphragm, and it causes a big bulge right here. It causes a lot of digestive issues, a lot of acid reflux and things like that. What's called a hiatal hernia. And so literally what they do is they're going to take this and they're going to pull it back down to where it's supposed to be and then stitch it in place or stitch that diaphragm closed a little bit so it doesn't happen again. And then we move down into the stomach. Purpose of the stomach, it is temporary storage of food. We are going to mechanically break it down because the stomach is going to churn, and by churning, it's physically breaking down food. And remember, when we swallowed the food, it was called a bolus. Well, now once food gets to the stomach, it is called chyme, and it is much more liquidy, much more fluid, because you've got a lot of digestive enzymes and hydrochloric acid that is secreted into your stomach. Also in your stomach is something called an intrinsic factor, which is secreted, and that's actually going to help your body absorb vitamin B12, and you need vitamin B12 for metabolism and for energy and things like that. There's 4 parts to the stomach. There's called the cardia, the fundus, the body, and the pylorus. And this part right here, so here's the esophagus coming down here. This part is called the fundus. This is the cardia, which is just the very beginning of the stomach where the esophagus meets. It's literally called the cardia because it's a part closest to the heart. This is the body, and then this is the pylorus right there. And there is a sphincter here, cardiac sphincter we call that, or the lower esophageal sphincter. And there is a sphincter here called the pyloric sphincter. Your stomach, when it's empty, is about the size of a sausage. So think about a Johnsonville brat. That's about how big it is when it's empty. When it's full, it typically can contain anywhere from 1 to 1.5 liters of material. So think about a 2-liter bottle of pop, half of that or 3/4 of that. If you try to stretch it any more than that, you're going to be really, really uncomfortably full. So about 1 to 1.5 liters of material. Now, the stomach can stretch. It's kind of like an accordion. And so there are ridges and folds inside the stomach, which are called rugae, that allow it to fold. And then there is a layer of fat that goes over our stomach, and it's called the greater omentum. And it's actually there to help protect our organs. This is the greater omentum right there. Okay. So what all gets secreted into the stomach? Hydrochloric acid, pepsinogen, which gets converted into pepsin, which starts to digest proteins. So in your mouth, carbohydrates start getting digested, but proteins don't start getting digested until you get into the stomach. Lots of mucus gets secreted, and then there's a hormone called gastrin that also gets secreted in there. A lot of this we won't really need to worry about today. Now, I told you that saliva starts breaking down carbohydrates in your mouth. Well, how long does that stay active then? So you've swallowed your food, it gets down into the stomach. As soon as your stomach contents fall below a pH of about 4.5, that salivary amylase is going to stop working. And that's anywhere from 1 to 2 hours after a meal. And that depends on a lot of things like how much you've eaten and that sort of thing. Okay, that is the end of the first part of the notes.